Hey, welcome back to Zombie Tactics. If you've watched my channel for long, you know that I focus fairly narrowly on things that I think are useful for what I call the citizen defender or the citizen first responder, not so much having to do with law enforcement or medical professionals or military applications and stuff like that. I think it's important if you're going to do videos on YouTube that you should stick as much as possible to kind of staying in your lane, talking about what you know and where you live. And that way you don't get ahead of yourself and talk about stuff you don't know anything about. Now, I know I drift into those areas a little bit from time to time, those other areas, but generally it only as a point of comparison to kind of bring things back to our role as a citizen with maybe a little bit more capability than the average Joe on the street. Now, certainly that's my approach to the use of firearms. You've seen my videos before about the importance of only using a firearm when you absolutely need to. You're not a cop, you're not a sheriff, you're not a member of the SWAT team. It's not your role to be that kind of a person. You're just there to be a citizen defender, to do what a citizen can do in those cases, to eliminate or to stop a threat. You're not there to, be the tactical hero or Jack Bauer or anything like that. Along those lines, I've recently begun getting kind of clued into the fact that, as a citizen, what's our real role? Our role isn't law enforcement. Our role isn't fighting off the invading hordes from some other country in some kind of a military maneuver. Our role really is to protect our own lives and the lives of our fellow citizens, at least those who we care about. And if it extends beyond our own little circle of friends and acquaintances, that's kind of our individual choice. But really, it's about saving lives or preventing harm. That's as much as we can do while we're waiting for, quote-unquote, the real professionals to come on the scene. Never is that more true than when it comes to emergency medical care or emergency trauma care. Just right on the scene, before the EMT gets there, before they can get somebody in an ambulance and get them carted off to the emergency room or the trauma center. What can you do as a citizen on the scene to save a life or to prevent further harm? It's become very clear to me that the ability to have some basic medical skills puts you in a better position to potentially do that, to save a life or prevent further harm, than actually even gun skills do. Say that you're in an incident where there's an active shooter and you're able to be the guy who, I have my concealed carry gun and I get it out and I make those shots and I bring down the bad guy and he's not hurting any more people now. That's great. What's the aftermath of that? The aftermath of that might be that you're sitting there bleeding to death. Other people around you are sitting there bleeding or hurt, and now you've done only half the job. It doesn't really, count as a win if you kill the bad guy faster than he kills you, only to bleed out and die 90 seconds later because he got a lucky hit to your brachial artery or something like that. So these kinds of medical skills are every bit as important, if not more important, than all the weaponry and stuff that we talk about like that. Along those lines, I've done some recent very basic medical training for emergency trauma care. Again, doesn't make you a doctor, doesn't make you an EMT, doesn't make you a medical expert on anything. It just gives you the potential, and potential is really the word, to have some skills to bring to bear to be able to save a life or prevent further harm in those kinds of circumstances. Along those lines, I've recently begun putting together my own personal trauma kit, just a small assembly of tools, if you will, of things to aid in that, to be able to have the very basic things that you would need to stop bleeding, to maybe open up an airway for someone to keep them breathing. Certainly I've done CPR training and things like that as well, so that, pardon me, if someone's heart is stopped or something like that, I can render aid in that direction. I've become certified on the use of the automatic electronic defibrillator device that, kind of does everything for you. You put the little stickers on there and hit the button and maybe shock them back to life. That's all real basic stuff, but it's also really very important to have those kinds of skills. And it's important to have a basic kit like this so that you can render basic aid. This kit goes with me, pardon again, to the range every time that I'm in a firearms training. When I'm not at a firearms training, it goes in the trunk of whatever car that I'm driving for that day, so that it's always nearby. You never know when you're going to come upon an automobile accident or the scene of some other traumatic event where you might be able to render aid and be the person that helps out there. So along those lines, I just want to show you the contents of my kit, not really go a whole lot into what every little thing is about it and open it all up and show it to you. That'll be for future videos. But this is just a basic idea of what an individual first aid trauma kit would be, an individual trauma kit, a ventilator operator kit would be, as Tactical Response calls it, a blowout kit, as some people calls it. Just my take on this and what I've put together for my own personal use in those kinds of environments. Okay, so let's check out the contents of our kit. I'm going to talk about the outside of the bag first, and then we'll talk about the bag and what's inside of it. Right off the bat, the thing that I've got that I want to have immediate access to is a good tourniquet. And what I've chosen in this case is the CAT tourniquet. Very common, very popular item. Not too much money, about 20 bucks. This is one of the more expensive things in the kit. And there are only a couple of things in this kit that are of any expense at all. I didn't like the way that this mounted on the outside of this bag through the MOLLE webbing, because the windlass here, which is a little stick that you use to tighten the tourniquet when you put it on, this was kind of flopping all over the place. So I did throw a piece of Velcro here that you can see, and I'll kind of tilt this so you can see it better. And this works fine with gloved hands or whatever. And all you have to do is the following. The Velcro comes off. You grab the top of the tourniquet. It comes off, and it's ready to be deployed immediately. Okay, no big issues there. Just makes it really easy to keep that on board the outside of the bag, easy to get to, and not flopping around all over the place. The second item, and I think it ought to be in every single kit, is something to write with. In this case, I've just made it a good old Sharpie. You can certainly use, other things, a Write in the Rain notepad and some other stuff. The idea that I've got behind this Sharpie is I can write on almost anything with it. I can write the time on the tourniquet here immediately when it's put on, so that's available for EMT or medical reference later on. If I'm talking to somebody and I think they're going to have a little problem staying conscious, I'm going to start asking things, well, like, do you know your blood type? Okay, says he's type A negative. You have any allergies? Says he's allergic to penicillin and, whatever what medications are you on? I'm going to just write this stuff right on his forehead or something like that. Or even if I don't have some kind of a card or something like that to write it on, writing this stuff on somebody's forehead or someplace where the trauma surgeon or a doctor later on is going to see it, that's part of taking care of them. And that's going to allow the doctor to do a much better job when he gets a hold of them. The outside of the pack, this is just a simple Condor brand pack. This is not a particularly beefy pack. If you're thinking about daily duty use as a police officer or something like that, I would recommend something sturdier than this. For the kind of use that I'm using it, where I'll take it to a firearms class or something like that with me, or throw in the back of my trunk, this is going to work just fine, and it'll do no problem for me. I've of course got the attachment straps on the back here for MOLLE attachment to a plate carrier or any kind of a MOLLE vest or anything like that. I wanted to have a handle on it. This didn't come with a handle, so I just did some real down and dirty real quick, not even much attention to detail here. You can see that it's not even very well done. Did a little bit of red paracord, the red paracord being kind of like, oh, the emergency color. I know that I can grab this and go. So that's that. Opening up the pack, we'll start talking about the items that are inside here. One of the first items I've got available to me is I've got a couple of pairs of black nitrile gloves. Those are mostly for my benefit. If I end up working on somebody who I don't know and I've got any kind of sense that they've got a bloodborne disease or something like that, these go right on. These are not meant to be sterile, as in protecting them 100% or protecting me 100% from germs or bacteria. It's just to put something between me and their bodily fluids. So that's going to go on there. Got a couple of rolls of duct tape. I'll put some links in the video notes to show you where this duct tape is available. These are, I think, 1 or 2 inch wide strips, and they're about 50 feet each, so quite a bit of duct tape. Duct tape is just useful for anything, medical, survival, whatever. Moving along, I've got an Israeli bandage, not an Israeli bandage, an H bandage. I like this better than the Israeli bandage. This particular version of it that I've got is not the flattest pack that you can get of this. There are better, more flat pack versions of this available. And an H bandage, that's just a good way to get some compression on a wound. You can even kind of use this as a sling or or in some cases a sort of a halfway tourniquet in and of itself. So I really like having that available in the kit just right as I open up the bag. Moving on from there, I like to keep a pack of Z-Pak dressing. This is just basic gauze that's in a crinkle, a Z formation so that it comes out really good. A lot of information has come out showing that it's not really good to have a rolled substance there. That rolled thing just starts rolling on the ground and getting dirty and everything like that. But in a Z-Pak configuration like this, you can feed it out pretty easily without losing track of it. I do have some Quick Clot combat gauze. This is kind of the same idea as the Z-Pak dressing, except the combat gauze is the Z-Pak dressing, and it has an impregnated hemostatic agent, just like all the Quick Clot and Celox and other hemostatic agents that are out there. Now you notice that this is a nice thin pack design here. This is designed to go into a bag like this, and so I'm going to recommend that if you do get something like this, get the thin version of that. Most of the older stuff that's in a roll, that is old. You do need to check your date on this. For instance, I'm checking the date on this, and I can see that that's going to expire in 2015. I want to make sure that if I'm buying something online, maybe from a bargain source, I want to make sure that I'm getting a good recent manufacturer, not something that's going to expire in a couple of months. Even if it expired recently, it's probably still good to use as long as this is not hard as a brick when you open the package. I would also avoid the older kinds of Quick Clot and Celox and stuff like that. You'll notice here there's a little logo that says heat-free, and that's because the earlier versions of these products did work on the basis of creating some heat along with the activation of the hemostatic agent. And in some cases, that was actually causing up to second-degree burns. So another reason to get recent product. All of the recent Quick Clot and Celox and other products of this kind of impregnated gauze, they all are of a no-heat or a low-heat design, so you don't have that problem with the burns anymore. Moving right along, I've got one last thing in the kit here, and that is I do have a nasopharyngeal airway, and I've got a little package of medical lube here designed to help insert that into a nose to perform an airway with that. I went ahead and I taped it to the package just with some simple, Scotch tape to make sure that these two items stay together. And that's kind of my whole medical kit in a nutshell. Now, as noted, this is intended to only be a kind of a very basic emergency medical trauma kit. There are a number of things missing from this kit that would be in a more complete trauma kit or a more complete first aid kit. Among those things are all the kinds of basic bandages, gauze, sterile wipes, things like that. I do intend to add a few things to this kit to make it more complete in my mind. One of those is some kind of alcohol prep or some kind of spray-on or squeeze-on disinfectant product or antiseptic. I think that's pretty important for a number of reasons. You don't want to be able to treat a wound only to have somebody die or lose a limb from an infection later on, and anything that you can do to help along those lines is definitely a good idea. Some other things that come to my mind, there's room for more of this stuff in the pack. Certainly, I can fit another one of these Quick Clot gauze kits in here, and I can get more of these Z-Pak dressing kits in here, particularly because these are cheap. These are about $2 a piece, so there's no reason to not throw more of these in the bag as long as there's room in the bag. This is still very compact, easy to deal with. I put some thought into the notion of having a chest seal. And I don't have a chest seal in here yet, and part of the reason is that they're kind of large, even when you get the ones that are smaller and designed to fold, to be flat and all that kind of stuff with all the air removed from them. They kind of don't really go into a kit this size extremely well from what I've seen so far. That's something that I'm going to experiment with. Maybe I'll do a follow-up to this video sometime in the future and show you how it's evolved over time. It occurs to me that I've got a lot of plastic packaging material around from other items that I've opened in the process of treating someone or rendering some kind of aid, and that along with the duct tape could probably make a pretty good improvised chest seal. The other thing that I've got missing from this kit is a what's called a Mojo dart or an angiocatheter for doing a tension pneumothorax relief or treatment. The reason that that's not into the kit right now is because, honestly, when I think of my abilities and how much I've worked with performing that particular technique, I'm just not really comfortable doing it. So I don't have that in the kit yet. That's something that I'll be adding as I work with that technique more and more and become comfortable with the idea of sticking a needle in somebody's chest. Not really there yet. So that's more about my comfort level and what kind of level of aid I'm comfortable giving at this point in time as a citizen with just a little bit of basic emergency medical training. I don't want to overstep my bounds. Certainly I'll do whatever I think is prudent in the situation to save a life, and hopefully I do the right thing, but I kind of don't want to pack my kit with a bunch of stuff that I'm not really sure what I'm doing with it yet. Some other things, there's definitely room for another one of these cat tourniquets on the outside. I may do that or throw another tourniquet on the inside. Future videos I'll be going over some options for things like this, an H bandage. There are other things like an Israeli bandage, other kinds of compression bandages, which is what this is, and I'll be showing you some of those various types. There are other alternatives to Z-Pak dressing. There are other alternatives to the QuikClot. There are alternatives to all of these products, frankly, and just as a part of moving on in this subject here, I want to show a number of those products and how they compare. That's Zombie Tactics for today, with just my rundown of my basic blowout kit, ventilator operator kit, individual trauma kit, whatever you want to call it. Thanks for watching, and we'll see you next time. Bye-bye.